theoretically go through a vessel, so you still have to be very careful. Let me have you sit up here for a second, Carrie. So Carrie has definitely some pretty deep tear troughs here. She also has darker skin there, so a nice combination would be some sort of a bleaching cream to soften that up. Her skin's a little bit dark for doing any sort of laser. I also like to always make sure I fill over here. She does not have much hollowing over here, but I'll sort of show you how I would do it because she has a teeny bit. And the other big take home is it Daniel? I'm going to show Daniel. I always use a vibrator for doing filler injections. And the reason vibrators work is something called the gate theory of pain, where you have a pain fiber and then a vibration fiber. And the vibration fiber actually sends off an inhibitory fiber to the pain fiber. And so that they feel almost nothing when you use it. Even we do lips and filler in the office just with the vibrator. And the first question people have in the office is, where's the vibrator? So we have them in every room, and trust me, the take-home message, you can see 10 different injections of how to do filler, but you get a vibrator, $10, it'll change your practice. We don't use any topical anesthesia except for laser work now. So Carrie, I'm gonna have you lay back, okay? So, you know, the cannulas come with a little needle, so you can start with the entry needle. And then, if I have you turn that on, and just kind of hold it right here. Can you still see if I do there? Now, yes, some people will take the vibrator and they kind of put it on someone's shoulder. It doesn't make any sense to me. If you don't have it near the area you're going to treat, it just doesn't, it's not going to work very well. So I'm going to turn you a little bit this way. So one of the things that's so frustrating is a lot of times when you put this little entry needle in, so it's like, I'll go in the direction I'm going to go, and then when I come back, Katie Goldie said this. She said, do a little flick with the needle. It gives you a teeny little hole so that then you should be able to find your entry point. And if you're really lucky, you get a drop of blood. I did a demonstration one time, a live demo, and sometimes there's nothing there, you can't find the hole. So what I'll do is come into the little hole here, and then I'll come across, and I do a lot of fat transfers, so it's sort of similar where I'll start deep, okay, Karen? And I'll come across, and so I'll come all the way across and then come back. So you can do either antegrade or retrograde, and I'll start to fill this in. So my first ones are deep, and then usually I'll go a little bit more superficial. I'm going to move you a teeny bit here. So now I can you see my cannula there?
Yes, we can.
So I'll go a little bit more superficial.
So what are the advantages for you of using a cannula for this treatment?
I like the cannula because I think I tend to get less bruising. I don't get little areas, you know, I think with a needle sometimes you get these little depot injections that you then have to massage in. Whereas this, I think you're just going back and forth, so you're sort of smoothly depositing the product. Now, obviously, you're then going to go back in and also smooth it out with your finger. But I've always liked cannulas, and I think they're nice because they really don't hurt at all. And I do a lot of fat, and it's the same way. Let me have you come on up here now. And you can stay here. So then if I'm going to do the outer cheek, can you still see? I can't see, so. I'll take my cannula and I'll come up, and you're going to have to pop through the orbicularis retaining ligament. So a lot of times they'll sort of feel it and hear it. You okay, Karen?
So is this for the palpebral malar group?
I've gone through the orbicularis retaining ligament, so now I'm doing the outer, kind of the lateral canthal area. Same way that Tahara did with her direct injection, and I've just done it this way. So I'll come from here, come up. Now some people are very hollow here too, so if they are, I'll also come and fill in. So I'll start here, come in through here, and then finish up and through there. Okay, so let's have you sit up for a second. So what we should notice now is that it should be fairly smooth. It should look a little less dark. Let me get put some Absolutely. And I think it's pretty quick. Can you see a difference there?
Yes, we can. We can see a shorter lid cheek transition there.
Yeah, and it should smooth out the whole thing. Now, they may be a little swollen today, especially because there's a little bit of saline in it. And then, so I have them ice it overnight, ice it today. And then you can still see, she still has a lot of freckles here. So if we could kind of bleach those out, it would definitely lighten up the whole area. Any pain at all with that? Yeah. No pain. Okay, so that's just nice. She was pretty deep, so maybe she could use a little bit more, but I'm sort of like the hero. I just do 1 tube at a time. And then if they need to, I'll have them come back and add a little bit, maybe another half tube or 0.25 on each side, but I usually start just with 1 tube, split it, and do it that way. All right?
Perfect.
Any questions at all? Or?
Do we have any questions? Just raise your hand and we'll send you a mic.
Now you can do laser treatments with us at the same time. Like if her skin tone's a little fair and she just had some dark circles, you could do some IPL at the same time or bring her back for that. I usually wouldn't do like a Morpheus or a microneedling treatment because I think at the depths that we do around here, you're getting right in. They say that the heat of the microneedling is not hot enough to actually dissolve the filler. But I think a little too much trauma sometimes it's not great. Now I would definitely do fractionated CO2 or fractionated erbium at the same time.
Perfect. I think there was a question about the product. So if you can remind us, John, what product you're using?
Yes, this is Restylane. Hand me a box there. Do I have a box?
Hyperdiluted Restylane, correct?
It's diluted Restylane L, right? Lift is too thick for this area, and it's been my favorite. Like Tahira, I've also used Redensity. I still like this one a little bit more. I'm a little bummed out because they wouldn't give us I had to bring this from home because it wouldn't give us a tube. I don't know what's going on with the Derma, but I guess we didn't ask nicely. So my rep gave me one instead because this is the one I always use.
Wow.
And I know Chad, I think you said you use this one too, right?
Yeah.
Okay.
John, do you have a lot of cases of edema after the Restylane, or is that one of the reasons why you prefer it over the Redensity?
Yeah, you pretty much never get the edema. You know, with some of the Vicross especially, you can get that prolonged edema, or even short-term or long, so you pretty much never see it with this. I have maybe had one person who just didn't like the way it looked, and so we have took it out with the hyaluronidase. The other thing that's nice about the Nasha fillers is that they're the easiest, excuse me, with hyaluronidase, they're the easiest to dissolve. And Sandy Zhang wrote an article about that. She looks at all the different fillers and how quickly and how little it takes to dissolve them. And usually it's one time for the Nasha technology, you can dissolve them all pretty easily. So that's one of the reasons why I like to use this too. Easy to put in, easy to get rid of. It was interesting, Chad, when you were talking about doing surgery. Sometimes if you do a lower lid surgery and there's filler, when you pull the lid down or go in transconjunctivally, it's just sort of sitting there like a gel. It's interesting. You can just take a Q-tip and kind of scoop it out. So some people are sort of wondering, are we doing our patients, what's going on with this filler that's sitting there for 15 years?
That's right.
You know, is it changing the orbicularis muscle? Is it altering, excuse me, is it altering the fat? Someone said that the fat always looks a little bit more vascular, so we know that it is inflammatory for the vascular epithelium, so is it doing other things in terms of inflammation as well?
Well, thank you very much. That's a beautiful result.
Thank you very much.
And